Welcome back to Rural Health News, the segment of Rural Health Today where we fill you in on the latest in rural health headlines. We'll cover 3 headlines in today's episode: what's most urgent, a rural health damage report, and a success story to send us into the week. First, what is most urgent? Last week, CMS issued a new rule to initiate restrictions on Medicaid provider taxes. Now, this has been an anticipated barrier to appropriate funding for hospitals under the One Big Beautiful Bill Act. But the reality of the new rules will be even more harmful to hospitals and rural communities than originally expected. CMS called it a loophole, that is, states implementing provider tax to help support Medicaid enhanced coverage, a perfectly legal way to increase reimbursement for hospitals and sustain health care across low-income communities. Under the new rules, new or increased healthcare-related taxes will be prohibited before the coming decreases allowable tax rates from 6 to 3.5% over the next several years. CMS is calling the federal Medicaid match under the enhancement program a tax scheme and a loss to the government. But their rules mean the enhancement program and the states that enjoy it will face new barriers in directing what they still can gain from provider tax to Medicaid coverage, which defeats the apparent motive of putting money back into the federal pockets. On to the damage report. This year's flu season is expected to be more severe for both patients and hospitals, largely due to plummeting vaccination rates. Clinical laboratories are reporting a higher volume of influenza A specimens and flu-related emergency room visits that are rising among pediatric patients yet this month. Hospitals will struggle more than usual to take care of all of these patients due to the ongoing measles outbreaks and other hospital pressures like closure of service lines and units and hospitals altogether as these cuts from the federal and state government are implemented. Internationally, widespread flu outbreaks are causing concern in Canada, the United Kingdom, and Japan. Cybersecurity is still a hot topic in healthcare, and for a good reason. Recently, at a Chicago safety net hospital, a hacker accessed employee email accounts that could contain patient information and compromise hospital security. Almost 7,000 individuals were affected by the breach, which is under active investigation. This is just one example of hundreds of ransomware attacks and security breaches taking place across the country and beyond. While healthcare organizations work to advance cybersecurity and learn how best to deter hackers, we must stay vigilant in protecting our patients, their health information, and our entire care teams. And now for our success story. Despite the weight of funding cuts and numerous new restrictions, there are still rural hospitals working hard to make a difference for our communities. One urgent care center in Newport, Vermont, opened its doors to patients who need overnight mental health stays as an alternative to emergency room boarding. This is the state's first around-the-clock walk-in urgent care for mental health services, paving the way for future clinics and hospitals to duplicate this model. Prior to last week, patients were limited to a 24-hour urgent care visit due to the facility's licensing, but now patients can stay for up to 10 days if deemed appropriate by their provider. The director of the program said it's about stabilizing our community, so you don't need to leave. It's really tailor-made for folks who are struggling with mental health needs. At Hillsdale Hospital, we know how important it is to care for mental health needs and provide alternative options to emergency room sleepovers. With a national mental health crisis impacting every community within the United States, we have to take care of the most desperate and vulnerable among us, and we commend this urgent care for their initiative. Thank you to our sources for this episode: Becker's Healthcare, the U.S. Department of Health and Human Services, Office for Civil Rights, and VD Digger.
Thank you for listening to another episode of Rural Health Today, the podcast where we connect you to what really matters in rural health. Rural Health Today is a production of Hillsdale Hospital in Hillsdale, Michigan, and a member of the Health Podcast Network. Our host is JJ Hodshire, our producer is Kirsten Newlon, and our audio engineer is Kenji Ulmer. Special thanks to the Hillsdale Hospital marketing team. If you want to submit a question for us to answer on the podcast or learn more about Rural Health Today, visit ruralhealthtoday.com.